Hey everybody. I just came back from doing yet another delivery where I had a shoulder dystocia, and it makes me remember how difficult this must have been. The whole scenario with Dr. Julian must have been. I didn't realize there was an update. I was looking the other day, and there's an update on the news. Let me read it to you. This is from WSBTV.com staff on February 7, 2024. Okay, the mother of a baby who was decapitated during delivery broke down in tears as lawyers held a news conference Wednesday and described his injuries. The news conference followed the announcement Tuesday that the baby's death had been ruled a homicide. Channel 2 investigative reporter Ashley Lincoln was in the room when the baby's emotional father, Trevion Isaiah Taylor, addressed reporters. "We want justice for our son. They lied to us. They wouldn't let us touch him. We didn't like it," Taylor said. "We just want justice for our son." Jessica Ross, 20, went into labor with her son, Trevion Isaiah Taylor Jr., on July 9, 2022, at Southern Regional Medical Center in Clayton County. I thought it was 2023, because I remember thinking at the time last year when they filed the lawsuit that it was pretty quick, but it was 2022. According to a lawsuit, the baby became stuck about 10 hours into Ross's labor and was eventually decapitated when the family's doctor attempted for hours to pull him out. Every 5 seconds feels like 5 minutes. So I don't know. There's just no way she could have been pulling him out for hours. There is just no way. You know, we're going to see some of the other things that her lawyers say. This is the first time I think I'm beginning to see pushback against the narrative. The family is suing the doctor who delivered the baby, Tracy St. Julian, my doctor. She delivered my first baby. Her OBGYN practice, the nurses and doctors involved in the birth and the hospital, citing medical negligence and the wrongful death of the baby. The lawsuit claims doctors pulled on the baby's head and neck so hard and manipulated them so hard that the bones in the baby's skull, head, and neck were broken. The hospital initially claimed that the baby died due to complications of shoulder dystocia, which is when the baby's shoulders get stuck in the birth canal. Few things are scarier than this. It is so scary. But according to an extensive report from the Clayton County Medical Examiner's Office, the baby's death was caused by the fractured dislocation of his upper cervical spine and spinal cord. By the fractured dislocation of his upper cervical spine and spinal cord. So see, they're still saying that it was dislocated, but I still find it hard to believe how they seem to be saying that the head was completely separated from the body. Sorry to be so crude. So dislocation, yes, you can pull the bones apart, but to have delivered the body by C-section and the head vaginally, I still don't get that. The cause of the death, again, was the baby's neck was broken while Dr. St. Julian applied excessive pressure on the baby's neck in the face of the shoulder dystocia, lawyers said Wednesday. Attorneys Roderick Edmond and Corey Lynch say they're determined to find out what happened inside a delivery room at the Southern Regional Medical Center. You see, they still don't know. They don't know either. So I feel like even the lawyers don't know for sure. And unless they're OBGYNs, they would not know that it's next to impossible to actually decapitate. Not saying that what she did wasn't wrong, but I feel like the decapitation, they're using sort of the technical decapitation term, but knowing that most of us would think like actual decapitation, like the head is off. Same conclusion, same difference, same outcome, but I think it makes it more sensational when they say decapitation. Edmund said that during shoulder dystocia, I owe it to them to find out what the hell happened, Edmund said. It's a bombshell. Really, it is. This isn't just about money. This young couple went trusting in the healthcare system. Edmund said that during shoulder dystocia, there are various maneuvers doctors are supposed to perform to free the baby that they say St. Julian and others involved in the delivery did not perform. If those maneuvers don't work, the standard protocol is to move to a C-section. And he's right. The first thing you do is call for McRoberts. That's when you pull the mother's legs all the way back, sort of to her shoulders. And then you do suprapubic pressure. That's pressure on the pubis, not the belly, but the top of the pubic bone to help to release. And this morning, that's exactly what happened. I had this great nurse. One nurse did it, and she was kind of at the wrong angle, and it was causing the patient pain, and then this, the seasoned nurse came in, put it at just the right angle. You could feel that shoulder just boop, releasing. Sigh of relief. Oh my God. So, and then, you can deliver the posterior shoulder. There's wood screw maneuver. There's different things, which I'll do a whole separate video on, how to get through a shoulder dystocia. But they're absolutely right. If those maneuvers don't work, you don't keep pulling for hours. I don't know where they got that from. I think they're including the time in labor in the hours, but there's no way, no human way that you're pulling on a baby for hours. There's just not. There's procedures. I mean, I know it's, Riverdale and Southern Regional, where the nurse made me pull down my underwear and test for my own nitrazine positive in the bathroom. Yeah, I remember you. I remember you, nurse. We'll get to that later. Let's see, but still, come on. Pulling for hours? All right, so if those maneuvers don't work, the standard protocol is to move to a C-section. Channel 2 Action News had previously reported on the allegations that St. Julian and the medical staff tried covering up the decapitation by lying to the parents and pressuring the family to cremate the newborn. They trusted their doctor. They liked their doctor. They liked the hospital. Now that's a lie. They liked the hospital, Edmund said, allegedly. And to be subject to the tragedy they were subjected to, then to double down on the lies and the deceit, they were devastated. Edmund said Ross Taylor asked to see and hold their son after his death and were told that they were not allowed to. It is normal, natural, proper, and right for parents after the baby is deceased to say, I want to see my baby. I want to hold my baby. I want to touch the baby's fingers. And they wanted that also, the family's lawyer said. The staff of Southern Regional Medical Center lied and said, you cannot touch your baby. I had a C-section, and I guess my daughter had a meconium, or I forget what the issue was. I was so out of it. I didn't see that baby for 3 days. The baby was down in the NICU, and I literally had to ask, did I have a baby? Where's the baby? Can I see the baby? They had to take me down in a wheelchair to go see the baby. Nobody